The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon here in Houston, Texas, with my Houston surgeons. And on today's episode of Confidence Doc podcast, we have Dr. Alaniz. Welcome to the show.
Thank you. So glad to be here. Excited to chat.
So, Dr. Alaniz, you are the first gynecologist that we've had on the show, and you are not just a gynecologist, you are a specialized gynecological oncologist. And I have so many things I want to ask you, but I just want to start off by saying, how did you get into this? How did you find yourself in medicine?
Exactly. So I grew up in Malawi. And my dad was a clinical officer, which is sort of like the equivalent of like a nurse practitioner here. But in Malawi, clinical officers are actually the main providers of healthcare because the doctor-patient ratio there is about 1 to 50,000. So really, your clinical officers / PA / nurse practitioner, which is what they would be here, are like trained C-sections, appendectomies. They see patients, treat them, and really without the supervision of a physician. So when I grew up, my dad was, practicing in like small villages around. That's sort of the place where he always felt like he wanted to serve. And so I would watch him sort of take care of patients. He had very, very little resources, but that was sort of like the norm for us. What really stood out to me with women's healthcare was, I'm the oldest of 8. And every time my mom would go have a baby when I was old enough, by the time I was 10, she had trained me to be like a little adult, right? Because a lot of women died in childbirth. And so a lot of the older girls really tend to be trained to take over the care of the family in case the mom didn't make it back from childbirth. So what stood out to me as I grew up is my mom would get pregnant, and whenever she would go deliver, before she went to the hospital, she would take me through the house and she would show me where everything was. How to take care of my dad, how to make this, how to do that, how to not do this, how to lock the doors. So, almost like a checkout.
You had a lot of responsibility from a young age.
Exactly. Mm-hmm. And so there was always a curiosity for me about what happened in there that made childbirth so dangerous. Why was my mom always anticipating to die? And I also, in some ways, she did that 8 more times. I kind of wondered, what responsible person would keep doing something that's so dangerous? And so I think when I was interested in medicine, I was really interested in answering that question. What was dangerous about childbirth? And was there something that could be done about it, in the setting that I was in Malawi? And of course, after I got the opportunity, to study here in the US, that was the question I wanted to answer and solutions I wanted to find to take back home and be able to do something about it.
So you really, it sounds like women's health has been at the core of what you've been interested and curious about since you were a very young girl.
Yes, definitely. Yes.
And so you grew up in Malawi. How did you end up in the U.S. and begin your studies?
So this was sort of like, I call this like winning the lottery type of thing. So I was living in a tiny little village. It's called Tonje, outside of Salima. Cars didn't even make it there. Most of the times to get to that village, you were like on a bicycle, ox cart, or you're walking on foot. Occasionally, there would be like a Land Rover that would sort of wade through the grass and make it out there. But it was very, very small. While I was there, the desire and dream to become a doctor was always something that sort of, was a part of me. There was actually a United States ER doctor who came to Malawi for a medical mission trip. So she came in, and for about 2 weeks or so, she was seeing patients, and she ended up working alongside my dad. And so during that time, she also came to the knowledge that he had a daughter who was really interested in going to medical school. I had gone through this very tiny primary school where I actually attended most of my primary school under a tree. And then when I finally got a classroom, it didn't even have windows, and we had like these sort of like mud bricks that got created into what looked like a bench that we would sit in. And so, but I studied really hard, because even though I didn't know how I was going to go to medical school, Malawi didn't have a medical school at the time, I knew that's what I wanted to do. So I'd actually gotten selected to a very nice secondary school in Blantyre. So when Donna was in Malawi, she was sort of looking at me as a kid who was really motivated, wanted to get further with school, wanted to go to medical school, but I had parents that obviously were never going to be able to afford to send me overseas, because at the time, most people in Malawi that were going to medical school would go to the UK. And unless I got a scholarship, there was no way that was going to happen for me, especially living where I was living. So she actually came back to the US and contacted my parents and asked them what they would think if she was to give me a private scholarship so I could come to the US to study and go to medical school. Yes, it was just like that. 2 weeks in Malawi. And she decided I had a lot of potential and just didn't have opportunity there. And she felt really strongly that, she wanted to be able to do something, for me to be able to achieve my dreams. And so I ended up landing in the United States actually on July 4th. In Dallas, Fort Worth. I moved in with her for about a year and ended up attending 1 year of high school in the US, and then went to college, did medical school, residency, and fellowship. And here we are.
That is amazing. I mean, talk about meant to be, right? Like the stars all lining up.
Exactly.
But
And the fact that she was there at the exact time that she was there, and in that period of time in my life, and again, like I think, the idea that sort of like dreams come true if you work hard enough. Like I literally think Malawians are some of the hardest working people I know. And Malawians that live in villages are some of the hardest people, that they work really, really hard to try to make ends meet. And so, but they don't always get what they want just because they've worked hard. So I think for something like that to literally just fall on my lap in a place where things like that don't happen was really unbelievable.
so did you go because you already knew you had such an interest in women's health? Were you someone that went to medical school thinking that's what I'm going to go into?
Yeah, so I started off like when I went to medical school, like, okay, this is what I'm interested in. And then I remember when we started doing our clinical rotations, our family practice rotation was a little bit interesting. So we rotated at this hospital, John Peter Smith in Fort Worth. It's a county hospital. At the time, the only residency program they had was a family practice residency program. They didn't have any other programs there. So the family practice, they were doing everything. They were doing C-sections and deliveries and colonoscopies and appies. And so for a second there, I thought, well, this is what I should be doing, because I'm going to be a surgeon, I'm going to be a GI, I'm going to be an OB-GYN, I'm going to be, so it kind of gave a different picture of family practice. So I do remember at that time having sort of like a moment where I flipped my thoughts and thought, if I go into family practice, then I can do all of these things other than just being, like a women's healthcare provider. Then I decided in my 4th year as an elective, I went to Methodist in Dallas, where they had a family practice program that was more like the Burbs, and it was a real family practice program. And I think at the end of the 6 weeks, I pretty much knew that wasn't it.
That wasn't quite for you.
It wasn't quite for me. And so I think the sort of the high energy county hospital, you're doing everything, had me thinking that's what it was going to really look like. But I wanted to make sure that whatever I did, I was going to love it here and I was going to love it in Malawi. So granted, with the training like a JPS, I would have been able to go to Malawi and do all those things. But the truth is, as a family practice doc here, I wouldn't be doing any of it. And I really wanted to make sure that I chose something that I loved no matter where I was located.
So how did you end up in oncology specifically?
Yeah. So when I went to residency, your first 2 years, you're a bit heavy on obstetrics. And so I really enjoyed obstetrics and, lots of high risk patients because I trained at a county hospital, University of Missouri in Kansas City at Truman. And so, things just sort of, people walked off the street with all kinds of things. I remember even a few times doing like perimortem C-sections in the ER. Like maybe a pregnant person got shot or they got stabbed and we have to deliver the baby emergently because mom's dying. And so, I had those kind of experiences and thought, oh gosh, I'm going to be capable of taking care of anything obstetrically complicated. So for a little bit, I even thought about doing maternal fetal medicine. But then as I started to get into my surgical rotations, I think of the surgical side, I don't even think I had that side often. When I went on surgical rotations, I felt small and I didn't feel like I had the personality of a surgeon, so I just sort of wrote it off. But then I think when I was in, OB-GYN and started more heavy on my GYN rotations and started to kind of do like Urogyn, where they were doing fistula repairs. And I knew that was a big thing in Malawi because a lot of women from protracted labors, babies that get stuck in the birth canal will get these huge fistulas. And I knew women that were sort of lived outside of the village because they were leaking urine all the time and kind of became outcasts. So that interested me in being able to be like, I want to be able to do surgeries that really change people's lives like this. And so after my Urogyn rotation, I really started to get more in touch with the surgical side of me. And then, I really found people that were good mentors in residency that really reaffirmed that they felt like I had good hands, gifted hands. And so, I went from thinking I'm not like these people to thinking, I could be these people. So when I did my gyn-onc rotation, we did a radical hysterectomy for cervical cancer. And that's one of those surgeries where the surgical exercise of sort of the dissection and the depth of the dissection and the advanced nature of the pelvic dissection, it was so impressive that I remember leaving that case and thinking, this is what I want to do. And so we were in the process of like, either I was going to be graduating and finishing, and I was almost to the tail end of when people were applying for fellowships. And I didn't even know if I was going to get any interviews at all, but I started putting in applications basically to fellowship for gyn-onc by the time I was finished with my gyn-onc rotation. I'd scheduled a vacation because everybody told me it was a very painful, hard rotation. I actually forego my vacation and worked the whole week I was supposed to actually be on vacation. And so that's when I realized that I had actually found what I loved. The patients, the complexity of them. I was able to do internal medicine with these patients. I could be like a general surgeon because you do bowel resections, hernia repairs, and reconstructive surgeries. And so it gave me sort of like what I felt I had in the family practice, but really more focused on the women because you can take care of them, from their primary care needs, to managing their blood pressures and cancer and surgically. And so it felt so natural to me on that rotation that whatever was painful for everybody didn't seem like it was so painful for me.
I love that. And I think for any young women who are interested in medicine who are listening to this, one thing I'm going to point out is you can tell there was a lot of good mentorship. You clearly had from the get-go, from you finding, that ER doctor coming, there were people that believed in you and supported you, which just made you blossom even more.
Yes. Yes. And I really think like life is really about that. I think, if we go through life and just sort of focus, okay, I'm going to get this, but what can you do with what's given to you for other people to make somebody else's life better? And I feel like my entire life has been a series of people that have actually walked beside me, gave me a lift to be able to get to where I am. If it wasn't for Donna, thinking, gosh, this kid has potential. And even though there were a million other kids that she could have helped, she chose me, and there are a lot of kids in Malawi who are smart. There are a lot of kids who were bright that went to the same school that I didn't get this opportunity, but she saw me and she decided to respond. And so I think that's also the very reason why, as I go through my life now, I've made that such an integral part of how I live my life as a physician. Like I participate in teaching the Texas A&M students, and I'm really invested in their growth. And as future physicians, because you have to give back, and then the things that I'm doing in Malawi now, it's all part of continuing to give that gift that was given to me.
And I mean, I think that that's just an amazing thing about you is it's clear that you want to continue that circle, right? You want to continue supporting, mentoring. And I definitely want to talk about, because you have done so much work in Malawi. You are the co-founder of Pothawira, and it is an amazing organization. And I would love for you to tell our listeners about it.
Yeah. So, when I was in medical school, actually before medical school, I went back home to visit my parents. And, I remember I had been in the US, it was like the land of plenty. And so the first time I was going back to Malawi, and even just landing at the airport in Malawi and looking at the fields, is sort of like how small all of a sudden, like, Lilongwe International Airport was big to me when I was growing up. We used to take field trips there and thought it was just such an amazing facility, which it still is. But I think I was doing that comparatively to like when I was landing in the US, huge buildings and highways and overpasses and, nothing like what Lilongwe looks like. So I think the first time I was acutely aware of sort of putting this side by side view of what my life had become in the US and what Malawi was, I sort of realized very quickly just sort of how far back we still were in Malawi. I'd been in the US where they could do chest compressions on 100-year-old and bring them back to life after their heart had stopped beating. And that's something I'd never seen before. And so, and to realize that, in Malawi, kids die from common things that could be cured in the US. And women are dying in childbirth from things that are preventable in the US. I think I was realizing more of that as I arrived there. So I worked with my dad and watched women give birth laying on trash bags and hemorrhaging, and watching children die from, dehydration from a bout of diarrhea, and their mothers carrying them on their back and, heading back home on foot 15 miles with a dead baby on their back. And so I think that sort of was the beginning for me of sort of questioning what was a greater purpose for being in the United States. Was it just I would educate myself and help my family build a house for my mom and dad, or was there something bigger than that? And so I think when I came back, that was sort of inside of me. I didn't know what it was going to turn into. So in medical school, that was the case. And often people would say, what do you want to do when you finish? Well, I'm going to do something in women's healthcare, and I'm hoping I can do something in Malawi. And so I hadn't had an idea of what that something was. And then in my second year of medical school, a group of us actually got together and we decided we would do a garage sale and buy land outside of Salima, which is, sort of outside of the village where I grew up.
In medical school, you did that.
Yes. Wow. And so we literally had people donate chairs and, different things like, like tables. And we set up a garage sale outside of one of my classmates' house. And people came and they bought the things. And then we actually found somebody that was like, well, whatever you sell, I'm going to match it. So we stole $1,500 worth of things. And he matched it, and we got $3,000. And so for $3,000, I bought the land that's now Pothawira in Malawi. And so it sat there actually it was just a way for me to know that I was supposed to do something with that land. And it's right off the road. And so I knew that if I was ever going to drive by there to my parents' house, I would remember that I'd bought land that I hadn't done anything with. And it was still waiting for me to do something.
You couldn't ignore it.
I couldn't ignore it. It would be like a sore to the eyes, right? And so so we bought the land. And then while I was in residency, kind of made some connections. And we built the outpatient clinic there. And so that outpatient clinic now sees about 200 to 300 patients a day. The majority of our patients are women and children, which, again, women's healthcare is what I was interested in. And the women take care of their children in Malawi largely because the husbands either go out to the city to work or things like that. So they're really the ones that hold the families together. So that's the focus. So I would say 65 to 70% of the patients we see are women and children. And then we see about, 30 to 35% men. And then we have since added a birthing center, as well. We have sort of like a live-in, family style for orphaned children. They have like houses where they live with sort of like parents. And we only choose really children that don't have anywhere else that they could go. They don't have a relative that could take care of them. Any kids that we can take care of that can live with an aunt or grandmother or things like that, we do that and provide them with scholarships and a way for them to attend school. But these are the ones where there's actually absolutely no one to take care of them. I realized very quickly 36% of the kids in our orphanage, 120 kids there, their mothers died giving birth either to them or to a sibling. And so it became very clear that if we were going to address the healthcare, we couldn't just have an outpatient clinic. We needed to be able to have like a birthing center. So we have a birthing center there. We have a school, again, because I truly believe that the future of Malawi is in the minds of the children. I sit here today. I'm talking to you today because somebody gave me education. So it's allowed me to be invited to tables that I would have never been invited to, where I can actually have more influence if I didn't have the chance to go to school. So, that's what we want to give our kids, take them from, a position where they have no influence to where they become the people that will have influence and help, children like them. So we have a school there, a primary school. And then we have like a computer lab, and recently actually received a grant from Deerfield. They're based in New York. And we just finished building a surgical center. It's actually finishing this month with 4 operating rooms. And this is in an area where they had one operating room for 560,000 people at the local district hospital. So, now we're going to be able to even expand, sort of the surgical services. Women had no access to C-sections. They would rupture their uterus before they were able to even get to the front of the line. And so this is going to be, life-changing. So, that garage cell now is an entire campus, that's doing a lot of good. Yeah.
I can only imagine how proud your parents are of what you've built and created. And it's very clear why you were chosen to go, right? Like you didn't just, like you said, you didn't just change your destiny. You're now changing the destiny of generations of people. So, I mean, you should be so proud of yourself because it's a beautiful thing you've done.
Well, thank you. Like, again, I think, it's really, for me, the inspiration has always come from the people that have helped me, have actually inspired me. I mean, my dad was educated and, clinical officer. He could have chosen to work in the city. He could have chosen sort of a better, more comfortable life, for all of us. But he always really felt very strongly that he was more needed in the villages, so, I mean, we grew up, really struggling, carrying water on our heads and walking to school. Like my first pair of leather shoes that I had was when I was headed to boarding school, when I got selected to go to Blantyre. And so, he always sort of chose the narrow, less traveled road, but that had the biggest influence. And so even my parents was inspiration to me, because I could have chosen to do something different. But I went back to the village, to this small little district of Salima. I remember one of these occasions I had a whole group of doctors that I brought along from the US, and the Minister of Health was processing our licensing. And she looked and she said, "Why are there all these American doctors going to Salima?" To her, she couldn't figure out what would be in Salima that would attract like 15 United States trained physicians. And so she was trying to investigate what that was and found out it was like, okay, it's a local girl that grew up there, that went there. But it got so much of her attention that she actually came on that trip. Came to Salima specifically to be like, what's going on here? So, again, I could have done that in Blantyre. I could have done that in Zomba. I could have done that in Lilongwe, sort of a bigger place. But I think, the same thing that my parents have done, I'm sort of following the narrow, less traveled road that can be difficult, but has, the biggest sort of impact on the community, because these are the people that have the least access.
Well, and need it the most. Like you said, it's easier sometimes to do certain things, but the path less traveled sometimes can be the most rewarding. Um, so you said you have 4 ORs there. Are people coming and going working there, or are there full time doctors now that are working there?
So the surgical center is actually finishing this month.
Oh, wow.
So we're getting
Congratulations.
it, yeah, we're getting it inspected. So we haven't opened it, but we've been doing surgeries at the district hospital in that one little room, which has been very, very difficult. We have a lot of patients that we send back. It's always really heartbreaking. We'll go back the next year, and patients we left last year will show up again. And for patients that have cancer, I think one of the hardest things that I've seen is that I saw them a year ago and they had treatable disease, and they're coming back and now they have advanced disease because for the year that I've been gone, they haven't been able to find anybody else to do it. So the goal for this is going to be twofold. We're going to be bringing physicians, CRNAs, anesthesiologists, sort of like comprehensive teams that have got, even scrub techs and circulating nurses, for reasons of not just coming in and doing a bunch of surgeries, but also training the local people to be able to do them. I always tell people that if you're going to do a good job of actually, whether you want to call it medical missions or you want to call it, bringing help to somebody, the best thing to do is to work yourself out of being a helper. And so my ultimate goal, I want to dream of a day where they're going to be doing so many of their surgeries that there's not really much of anything else for us to do. Because we've trained the nurses there to be able to circulate. We've trained scrub techs there. We have trained anesthesiologists there. We have trained breast surgeons, plastic surgeons, gynecologic oncologists. They're able to do these procedures. I think even in the short time that we've been able to do things at the district hospital, one of my most exciting times is when I go back and one of the clinical officers comes up to me and says, "Hey, I did my first hysterectomy, 2 months after you left, and patient did great," because then I know that we're living a gift that's going to keep on giving. And
And
so,
you're going to help so many more people than just the times that people are able to come.
Exactly. So like right now, when we leave, some of those procedures aren't happening anymore. And that's why we're finding women that came to me with treatable cancer that I could have surgically treated a year ago, and they're coming back a year later because they have found no one to do the procedure, and now they're too advanced for treatment. What I would like is when those patients come in and be like, "Well, we leave this week, but Dr. So-and-so here is fully capable of doing this surgery for you," and that's ultimately the way it should be. They shouldn't just wait until help comes. They get to a place where they can help themselves.
Well, you are just a fascinating person, and I feel like you're just getting started. Like you've accomplished so much already. I cannot wait to see whatever all your work will continue to grow and what will happen. For any of our listeners who are just, they've just become really inspired by this, if somebody is interested in helping or getting involved, how could they do that? How could they learn more about the project?
Yeah, so we have a website. It's called www.pothawira.org. Usually, if you go there, you're going to find all the basics about the organization. For people that are interested in making donations, they have a donation button. People that are interested in being able to go on a trip with us, there's like multiple ways to go on a trip. And to be honest, because we have so many aspects of what we do, I've never had anybody that's gone where they didn't find something. So even if you're not a medical person, there are people that have come and helped with our school. We had somebody who was actually an English as a second language teacher here in the US who spent 6 weeks there, teaching English, because Malawi was a British colony. So the curriculum turns into English in 5th grade. So all our kids really need English proficiency. So she didn't know there was anything she could do. She got there and found, a way for her. We had a lady who knew how to sew, and she's like, "I don't know what I'm going to do with that." And she got there, realized that a lot of the local women use like the local textiles, and they make beautiful clothes from it, but don't always have access to tailoring. So she actually started our tailoring program there. So, there's something for everybody. So if you go to the website, you'll find out about our trips and when they're going to be happening. And for the medical surgical people, now that the surgical center is opening, we're going to create teams that can probably go like every quarter, so that we're not just doing one trip in the summertime. And that was, again, limited by the fact that we had limited space. But now that we have 4 operating rooms, we're planning on bringing laparoscopy, all those different things that we'll be able to actually do and help more patients, and also do a lot of teaching. There will be trips now that are going to happen throughout the year, and it's not going to just be limited to like one time in the summertime like we've traditionally done.
Well, that is exciting. And I know my
Yes.
husband and I are planning to join you when everything
Please
is ready.
do.
We
Yeah.
are very excited. And thank you so much. This was so wonderful to hear. And just like, I feel like all of us could be doing a lot more, like after listening to you. And I really hope everyone listening has been inspired. I think part of our purpose on this earth is to lift others up and to help the next generation. And I just like, I feel so inspired and excited for what the power that each of us has to make the world a better place.
100%. I always say that I think often we always think about what we don't have. And I've definitely done that. I mean, as you know, women in surgical field, we tend to have these little imposter syndromes that we walk around with. And there are so many times we think, I don't know if I can do that. I don't know if I have the skill set to do that. I don't know if I have the financial resources to do it. But really, like along the way, I mean, think about it. This land was bought with money from a garage sale. And it was a bunch of medical students who had no money and they had loans, if anything, and we got together and we were able to make a difference in that way. Every year I climbed Kilimanjaro. That was one of the only ways I could figure out to raise money. Like at some point I realized, I didn't grow up in the US. I don't have roots in the US. And so, even to do like a fundraising event was really hard to figure out who would come. And I would probably put more effort into the fundraising event than what I got back. So I had to start looking like, okay, what can I do? What do I have? I figured out somebody was, people raise money, doing marathons or different things like that. And what's bigger than Kilimanjaro, right? So
Yeah.
once everybody realized I was about to die for the work in Malawi, they were ready to write those checks for me.
They're like, take
to
this,
go-
take this, relax.
Exactly. So I've gone back every year. I mean, like next year will be my 10th climb, and it's been one of the most successful sort of fundraising events because now I have people who join me that, their families and friends would never donate to me, but because one of their families is, climbing with me or hiking with me, they donate to them. And that has just sort of multiplied, their influence. The first time I went, I think I might have raised like maybe $5,000 or $6,000. And we've gotten to a point now that when we take a group, there's 8 or 10 people, we could raise $100,000, even more. And so, I think we all have something that we can give. And it doesn't always have to be big. I think sometimes when people listen to something like this, it's overwhelming because in some ways you're sort of thinking, well, I'm never going to be able to do anything like that. But if you think about Donna isn't establishing an organization in Malawi. Donna helped just me. She picked one kid and sent that kid to school. That is all she did. But look at what the ripple effect of that are. So you don't have to think, I need to go start a big organization in Africa. Sometimes it's just about you look around your community. Whose life can you touch, even if it's one person? Who can you show kindness to, right? Because the ripple effect of that is something that you may not, know, but that person will remember. So I'm a little bit of an English nerd. So just to kind of, like one of the things I'm going to read this Ralph Waldo Emerson, poem, one of my favorites. It says to laugh often and much, to win the respect of intelligent people and the affection of children, to earn the appreciation of honest critics and endure the betrayal of false friends, to appreciate beauty, to find the best in others, to leave the world a bit better, whether by a healthy child or a garden patch or a redeemed social condition. To know even one life has breathed better because you have lived this is to succeed. And honestly, this is how I try to live my life every day. It doesn't have to be anything of this magnitude. We all have the capacity to make the world a better place.
Oh, you're making me tear up. It's beautiful. It's like, well, thank you so much, Dr. Alaniz, for being on the podcast. I always leave it with that. I hope everybody has learned something new, but in this case, I hope everyone is inspired to do something new. Take that first step, do something, because you never know where your ripple is going to lead.
100%. Thank you so much for having me. This was great. All right.
Thank you, everyone. And thank you. And tune into the next episode. I don't know if it'll be as inspiring, but I know it'll be amazing. So thank you so much.